Okay, so I'm gonna start with her quadrants, and you want to hear, I don't know how loud I'm talking, I can't hear myself, sorry. I don't want to, I want to hear 5 to 30 vowel sounds per minute, but for the sake of this video, I'm not gonna hold this for a minute at every spot. Okay, so now that that is done, I will use the bill. And I will go over the umbilicus. I need to get my fingers right. And then I will start with her iliacs. Her renal. Her aortic, which is over here. And her epigastric, which is, sorry, right here. Okay, I hear no bruits, no venous hem, no anything. Sounds good to me. Just gonna clean this off real quick. Okay, so now I'm gonna do percussion. So over the air-filled organs, I will want to hear tympani, and over, air-filled organs, sorry, I said that wrong. Over the organs with air in them, never mind, I guess that is right. I want to hear tympani, and then over her other organs, I want to hear dullness. So I'm going to start here, and I'm going to make sure I have my 2 fingers like this, keeping this finger flat. And I'm hearing what I need to hear, feeling what I need to feel. So that's good.
So what we're going to do is we're going to listen for vowel sounds with the diaphragm, and we're going to listen in all 4 quadrants, starting in the right lower quadrant. Now, like said before, the patient's shirt would usually be up and I'd be listening. However, privacy, we're going to leave the t-shirt on. So we're going to start in the right lower quadrant, and we're going to listen for 5 to 30 seconds and 5 minutes if we can't hear any bowel movement. Then you move up to the right upper quadrant. Once again, listen for 5 to 30 seconds. The left lower quadrant and the left upper quadrant. So usually if you can't hear those right away, you want to listen for at least 5 minutes to make sure that the vowel sounds aren't absent, as that could be an indication of an obstruction or an issue that needed to be handled. So next, we are going to be listening with the bell side of the stethoscope, and we're going to be listening for vascular sounds. And there's 7 spots, so we're going to start on the right side, it's the closest to me, and we're going to be listening for the femoral artery, the right femoral artery, and then listening for the right iliac artery, and then the right renal artery. Then we're going in the middle of the abdomen to listen to the aorta. Then we're moving over to the left side and repeating on the same arteries. So the renal artery, the left iliac artery, and also the left femoral artery. So here, what we're listening for is we're listening to see if we can hear any bruit or whooshing sounds, which could indicate narrowing of the artery or an obstruction once again. So after we have auscultated the patient's abdomen, we're moving on to percussion. So we're going to do percussion in all 4 abdomens, and we're looking for general tympany. Usually if you hear a dull note, that usually means there's some sort of distension or fecal matter. And if you hear a hyper-resonant note, there could be gas gas distension. So we're going to start again in the right lower abdomen, and we're just percussing. Okay, and we hear general tympany throughout. We're going to percuss the CVA after we palpate. So now we're going to move on to palpation, and we're going to start with a light palpation. So once again in the 4 quadrants, and here we're just seeing if our patient is grimacing or if they're in any pain. Are you in any pain? No. Here we're also looking for superficial masses or nodes as well. And then we're going to move on to deep palpation, which is with both of our hands. And here we're kind of looking, once again, for pain and masses, but we're also looking at the organ size as well. So we're going to start in the right lower quadrant again, and then move around in all 4 quadrants. And once again, we're looking at the patient's demeanor to see if they're grimacing or if they're flinching, to acknowledge any pain that they're feeling. So now we're going to look at organ size, and we're going to start with the liver. And normally the liver is only palpable 1 to 2 centimeters, but we're going to palpate anyway. And it is in the right upper quadrant. So I'm just going to feel around using both my hands. I'm going to have the patient inhale and go under and exhale. And I can slightly feel the liver, only 1 to 2 centimeters, but that is normal. Now we're going to move over to the left side, and we are going to palpate for the spleen. And normally the spleen is not palpable because of where it lies behind the stomach, but we try anyway. And we also can palpate for the renal system or the kidneys. So we're just going to lift the patient up and feel in the back and see if we can feel. Yep. And then we're going to do it on both sides, everything bilaterally. And we're feeling, seeing if it causes any pain, feeling for any enlargement or abnormalities. And then we're also gonna palpate the aorta. And so we would just feel for the aorta, which should coincide with the apical pulse and the rest of the body. So now that we have palpated, we're going to move on to some specific signs to test for inflammation within the abdominal region. So the first one is the rebound tenderness sign, or the Bloomberg sign. And I'm just going to have the patient lay flat, and what we're testing here for is possible appendicitis. So I'm going to press down into the right lower quadrant, quickly remove my hand. Any pain? If she did feel pain, which she luckily did not, that could be a sign of inflammation in the appendix. I was touching my left side, I meant to touch my right side. So now we're going to move on to test for inflammation in the gallbladder, so cholestasis. So we're going to go up towards the liver, and I'm going to use deep palpation once again. And I'm going to have my patient inhale for me and go under and press in, exhale. Feel any pain or tenderness? No. Usually if the patient did feel pain or tenderness, that would be a sign of an inflamed gallbladder. The next sign that we are looking into is the iliopsoas sign. So I'm just going to have my patient lift up her right leg, and I'm going to put pressure, and I'm going to have her resist my pressing down. You feel any pain in your right lower abdomen? Wonderful. If the patient did feel the pain or burning sensation or had trouble resisting my pressure, that could be a sign of appendicitis.
All right, so first I'm just going to take a look at your movement. I can see respirations. I don't see any palpations or peristaltic waves, which is completely normal. You can't really see that in people. So next, I'm going to take a look at your contour. You look like you have a flat shape, and your stomach contour is symmetrical, which is good. Next, I'm going to take a look at your skin. You look like you have a nice light pink color. I don't see any abnormalities, just a couple of moles, which is completely normal. And next I'm going to check your umbilicus, which is your belly button. And it appears to be midline vertically and horizontally. It is inverted and I don't see any abnormalities there or any umbilical herniations. Next, I'm going to take a look at your muscles. So if you could just pick up your head for me. All right, I'm going to check your rectus, your inguinal, and your femoral. And I don't see any herniations there, which is good. Next, I'm going to auscultate your stomach just to listen to your sounds. So I'm going to start in the right lower quadrant. All right, so I heard about 7 bowel sounds in a minute. I heard the gurgling sounds and they were high pitched, which is completely normal, and I didn't hear any abnormalities there. Next, I'm going to take a listen for bruits, and I'm just going to check your aortic, your renal, your iliac, and your femoral. I'm going to come this way to check your femoral. All right, and I didn't hear anything there, so that is completely normal, no abnormalities. Next, I am going to percuss your stomach, just listen to what it sounds like. All right, so I don't hear any abnormalities there. I hear tympanic sounds over the air and dull sounds over your organs, which is completely normal. Next, I'm just going to percuss your gastric air bubble right along this midline. And that sounds hollow all the way across, which is normal. Next, I'm going to percuss your spleen. So I'm just gonna walk my fingers down to your 9th through 11th intercostal space. And I hear a dull sound over your spleen, which is completely normal. Next, I'm going to palpate. So I'm gonna start with light palpation. So just let me know if you feel any tenderness. Any tenderness in the lower right quadrant? Any tenderness in the upper right quadrant? Any tenderness in the upper left quadrant?
No.
Any tenderness in the lower left quadrant?
No.
Okay, so I forgot to percuss your liver. So I'm going to go back and do that right quick. Luckily, I haven't done any deep palpation, so hopefully we can still hear everything. So I'm going to start at your 5th intercostal space and work my way down. Alrighty. And then I'm going to work my way up from the bottom. All right, so the diameter of your liver is about 6 centimeters, which is completely normal because the mean diameter is 6 to 12 centimeters. So to continue on with my palpations, I'm going to now do deep palpations. With your light palpations, you didn't have any tenderness, and I didn't feel any, starts with an M, give me a second. Masses. Okay, so now I'm going to deep palpate. So I'm just going to do a dipping motion. Any tenderness there? Any tenderness there? Any tenderness there? Any tenderness there? All right, so no tenderness, didn't feel any masses, no abnormalities there. So next I'm going to palpate your spleen. So if you could take a big deep breath in for me. All right, and I can't feel your spleen, which is good. That means it's not enlarged. Did you feel any pain there? All right, so next I'm just going to check your right kidney. So if you could take a big deep breath in for me. All right, do you feel any pain there? All right, I can't feel your right kidney, which is completely normal. Take another big deep breath in for me. All right, any pain there? All right, I couldn't feel your left kidney, which is completely normal again. So take one more deep breath for me. I'm gonna check your liver. Any pain there? All right, and your liver feels normal. So that completes my assessment for today. Is there anything else I can help you with? All right, have a great day.
Thanks. Just going to pull your shirt up. Sure. Okay, I'm going to auscultate in the 4 quadrants, moving clockwise, listening for 5 to 35 gurgles or swooshes. If I did not hear any, I would listen for 5 minutes in each quadrant, moving clockwise, starting in the lower right quadrant because that is where the bowels are most active. Okay, I'm going to now palpate the abdomen. If there's any pain whatsoever, let me know. No. Any pain here? No. How about here? No. Okay. There was no guarding or rebound tenderness indicating that she was telling the truth about the pain. Okay. Her abdomen is not distended or barreled. She has a nice concave, flat abdomen. Okay. I'm going to now go down and, sorry, we can listen this back.
All right, now I'm going to go ahead and listen. Sorry, I gotta find your belly button. It's a little there. Okay. Just listening to the aorta and the renal and the iliac and the femoral arteries. Okay, it'd be this area over here. Okay, very good. Let me know if you have any pain at any time. Okay, we're gonna go ahead and percuss the liver. You're supposed to hear them, but over the pulse it's a little harder. Okay, we're gonna pump. Any pain? Nope. Okay, now we're gonna go ahead and feel for your kidneys. Okay. Okay, very good. And let's see here. Oh, I'm gonna have you just go ahead and roll a little bit onto your side. I'm just gonna check here. Okay, go ahead, sorry, you can go ahead and lay back flat for me. Just checking your spleen. All right, and we'll go ahead and listen. All right.
All right, so looking at your abdomen, there's no distension, it is symmetrical, your skin is appropriate for your ethnicity, there's no scars, lesions, or bruises, there's no paler, cyanosis, edema. So with that, I'm gonna go ahead and I'm gonna first listen to your vascular sounds, make sure there's no bruit, and I'm gonna listen to your bowel sounds.
Okay.
No bruit noted. Next, I'm just gonna start in your right lower quadrant. Right upper. Left upper. And then your left lower. Perfect, so your bowel sounds are equal in all 4 quadrants. Next, I'm just gonna go ahead and palpate. Let me know if there's any pain or tenderness. Any pain?
No.
Perfect. Now I notice while touching your skin is warm and it is dry, so that is a good sign.
So I'll go ahead and start my assessment, and I'll warm the stethoscope before I place it on her abdomen. And I'm just listening for gurgling sounds in the right lower quadrant, moving up to the left right upper quadrant, the left upper quadrant, as well as the left lower quadrant. And there is gurgling sounds in all 4 quadrants, is within normal limits. I'm also going to be listening for the aorta artery, as well as the iliac arteries, the renal arteries, and the femoral arteries. And I will be listening for any bruits that would indicate that she has atherosclerotic plaque forming, and that would require further a follow-up. But I will go ahead and take a listen. And the aortic artery is right above the umbilicus. So I'll take a listen with both the bell and the diaphragm of my stethoscope. And make sure that there's no bruits. And I'll move down to the iliac arteries as well. Make sure that there's no bruits that I hear. And then I'll move over to the renal arteries. I do not hear anything. It's all within normal limits. And then I will also listen to the femoral arteries, normally on bare skin, but we're just going to go ahead and take a listen with the pants on. We'll take a listen, and I do not hear any bruits at this time. It's all within normal limits. Alrighty. Next, I will be percussing her abdomen, and I will be listening for tympanic or dull sounds. Tympanic would be over hollow organs, and dull sounds would be over organs that are like your liver and your spleen, so solid organs. So I'll start again in the right lower quadrant, and I'll be tapping my finger to listen to the percussions. And I will move all around to the right upper, left upper quadrant, and the left lower quadrant. And I do hear tympanic sounds. So everything is within normal limits. I will go ahead and assess for her liver and the borderline of her liver with percussions. And I'm going to start with the midclavicular line close to the umbilicus. And I'll work my way up until I hear some dullness. Alrighty, and when I hear that dullness on the liver's border, I'll go ahead and take my, my pen and I will mark that area. And then I will assess the upper part of the liver and in between the intercostal spaces. And once I feel the liver's top border, I will go ahead and measure that and make sure it is within 6 to 12 centimeters. And that is at 6 centimeters, so this is within normal limits, and her liver does not appear to be inflamed in any way. I will also percuss for her spleen on the left side, and usually the spleen is located underneath the ribs, so I should not hear any type of dullness. And I do not hear any dullness, it's all tympanic. So her spleen does not appear to be inflamed either. I will also take a listen and percuss for her urinary bladder, and it'll be right above the pubic bone. So I'll go ahead and percuss, and it's tympanic here. And if her bladder was full, I may hear some dullness right above the pubic bone, but it is not full at this point, so it's all tympanic. And then next, I will begin to do a very mild palpation, a very, not deep, but shallow palpation. And I'm going to be palpating for any kind of masses, any type of tenderness, or anything like that. So Amy, if you feel any tenderness, please let me know. So I'm going to start in the right lower quadrant and just lightly palpate to the right upper quadrant, the left upper quadrant, and the left lower quadrant. Do you feel any tenderness? All right, and I'll go ahead and start my deep palpations. So I'm going to deeply palpate for any tenderness or masses in your abdomen, anything abnormal. And do you feel any tenderness or anything like that? And then I will have her breathe in deeply so that I can palpate the border of her liver. So go ahead and take a deep breath, Amy. And I'll palpate kind of for the border of her liver, which is I do feel. And it does not feel enlarged or anything abnormal. And then I'll also try to palpate for her spleen as well. Go ahead and give me a deep breath, Amy. All right. And as I'm palpating, I do not feel anything, which is a good sign. It means that the spleen is not enlarged. And so next, I will be doing a palpation for something called Murphy's sign, which is palpating for any cholecystitis. So if there's any inflammation in the gallbladder, she's going to feel a lot of pain right underneath the liver area. So I'm going to go ahead and do a deep palpation. And Amy, if you feel any tenderness, please let me know. Any tenderness? Alrighty, and so that is the Murphy's sign. I will go down to the sign to test for appendicitis. It is called rebound tenderness, and I will be palpating right in between the umbilicus and the anterior medial iliac spine. And so when I'm gonna go ahead and palpate deeply and then release quickly. And if she feels any pain, either with palpation or release, it could mean that she may have appendicitis. It's also called McBurney's point. In between the umbilicus and the iliac crest here is McBurney's point. And if it is tender, that it could mean that there is some appendicitis going on. I will also assess for any ascites with any patients that do have ascites. This is called the tidal wave test, where if Amy places her hand in the middle of her abdomen, and I'll take the right side of her abdomen, normally when a patient's supine, the ascites moves to the back of their body. And so with this test, I'm going to push on the right side of her body and towards the back. And if there's a wave of fluid that shifts to the left side, that's called the tidal wave test. And that is to test for ascites. There's also another test called the dullness test, and it is where when you percuss lower down, you'll percuss from further down all the way across the abdomen to the other side. And if there is ascites, you will hear a dullness on the back lower sides of the abdomen, and you'll hear a tympanic over the top. And then next, we are going to assess for a CVA tenderness. So I'm actually going to have Amy sit up, and we're just going to adjust the camera